Hi everyone, I'm Dale Smith, aka Journo Dale, and we're here to talk about Canadian politics. This week, in these pandemic times, there's a couple of things I wanted to just make a couple of mentions about so that we can start thinking about them in a slightly different way. The first of them is the mask debate, and this has kind of come to the fore in the last week. And people have been accusing the chief public health officer of changing her tone on it and of flip-flopping, and that's not been the case at all. And I think that just needs to be borne out a little bit and explained. Her advice has always been that wearing a mask isn't going to prevent you from getting it. And also that medical grade masks need to be kept for medical purposes. And, the other message has always been, if you're symptomatic and you need to go out, it can, help possibly to arrest the spread a little bit. And that's really been about it. Later this week, it kind of became a thing where, okay, if it'll make you feel better if you go out, you can wear one. But again, it's not going to prevent you from getting it. And if anything, it might help you prevent the spread, or you from spreading it if you have it. But again, we don't have any hard epidemiological numbers to say how much it could stop a person from spreading it. And there's even more evidence that the mask is likely going to be more of a placebo, not a placebo, give people a false sense of confidence that if I'm wearing a mask, I don't have to do other measures like physical distancing, or it becomes more tempting for people to touch their face as they're adjusting the mask and so on and so on, not necessarily consciously realizing that they are contaminating their hands when they do that, and then they touch their eyes or their face or so on. And so that's why public health officials have been very reluctant to say everyone wear a mask, because it's likely not going to do very much. We've seen a lot of media in particular here be very concerned about the mask debate and wondering why aren't we recommending more people wear them, particularly because things like, they see they're wearing masks in Taiwan and their infection rate is lower, but correlation is not necessarily causation. There are other reasons why, infection rates are lower in Taiwan, and a lot of that has to do with the kinds of social controls that they're able to exert there that are a little harder to exert in a Western country like ours. So I think the mask debate has been particularly blown out of proportion this week, and I think that Dr. Tam has been unfairly criticized for some of that as part of this. The other thing I wanted to just kind of mention is the whole debate around modeling, and why wasn't the government being more upfront about the modeling, and why weren't they releasing models sooner, and when they did release models, why aren't you telling us when the peak is going to be? Why aren't you telling us how long this is going to last? These are questions that nobody has answers to, and providing models isn't going to give you those answers, and that, I think, it's frustrating for people, but it's something we need to keep in mind. It would be great if we had an end date where, yes, if everyone keeps up these measures for another 4 weeks, then everything will be fine and dandy, but human beings are not, we're fallible, we don't always follow the rules, and so, what we're seeing in terms of infection rates and hospitalizations and so on are lags from the amount of time between infection and when things start showing. So I think the focus on modeling has been a little bit wrong-headed, and to the extent that some people have gotten completely self-righteous about it, I think has been a problem. One of the other things, though, that I think is kind of disturbing from my own perspective is the ways in which the human mind looks at numbers like these. There's that aphorism that one death is a tragedy and 10,000 is a statistic. And that's what I worry about when people are demanding these kinds of models and immediately glomming on to the possible projected death rates. Because we and this is how human minds work, is we reduce those big numbers to statistics, and that's when people start talking about things like what's an acceptable loss rate. And that's one of these things that I think we should be very careful about. Because do we really want to be sacrificing, the entire population of long-term care facilities in this country as an acceptable loss? I don't think that any politician wants to make that particular calculation, and we as citizens shouldn't want to have people making that consideration as well. So that's why we need to be careful when we're demanding these kinds of figures, because that's the kind of psychology that can happen around it, and that isn't necessarily great for society overall. So these are things that we should be keeping in mind as the news continues to roll out, and as we continue to remain in self-isolation or quarantine or shelter in place, or however we're describing it. And that's everything for this week. Join us again next week for some more Canadian politics. I'm Dale Smith. That's at Journo_Dale on Twitter. And don't forget to like the video, share, subscribe, and support us on Patreon. Thanks, everyone.